Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye.
My patient was a 70-year-old Caucasian male without a history of prior uveitis who underwent uncomplicated vitrectomy with membrane peeling and ILM peeling in his left eye. When the patient did not comply with his post-operative anti-inflammatory eye drop regimen, he returned with panuveitis and macular edema. This was managed with increasing topical steroids and a short-duration intravitreal corticosteroid implant. Macular edema recurred despite topical steroid drops twice a day, and 2 additional short-duration intravitreal corticosteroid implants were given. Compliance with drops was again limited. Based upon the demonstrated need for chronic anti-inflammatory treatment, poor suitability for topical coverage alone based upon repeated compliance issues, and good prior responses to intravitreal steroids with controlled uveitis and macular edema, the intravitreal fluocinolone implant YUTIQ was recommended. Despite having macular disease, prior epiretinal membrane and macular edema, and a multifocal intraocular lens, which may reduce visual outcomes, the patient's visual acuity improved from 20/80 before macular surgery to 20/40 after surgery. Acuity declined to 20/60 due to macular edema, but recovered to 20/40 with YUTIQ treatment, which has provided sustained control of inflammation and macular edema for 18 months of follow-up to date. A few noteworthy thoughts. The patient was afraid to return to follow-up due to concerns about COVID-19, and the YUTIQ implant provided him with sustained control during that absence. Laboratory workup for uveitis was negative, and that is not uncommon for sustained post-surgical inflammation. The actual cause remains unknown in most cases, but responds well to steroid treatments. Visual acuity deficits from macular disease are often amplified when the eye has a multifocal intraocular lens, so control of macular edema is critical for achieving the best visual acuity outcome. I will continue to monitor the patient for inflammation and changes in IOP, and if either occurs, I will treat appropriately.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.